Hi there, and welcome to Health with Dr. Yvette Masaka. This is a podcast that aims to correct myths around health. And today we're going to be talking about life as a male nurse, and I'm joined by Robert. Robert, hi.
Hi, Dr. Yvette. Thank you for
Thank you
hosting
for
me.
thank you for coming.
That's all mine.
So tell us, Robert, why did you choose nursing?
Basically, I wanted to choose something else apart from nursing.
Mm-hmm.
Yes, I wanted to do radiography or clinical medicine. Yes, but I had to look at again what was on the market, which one they were picking more. Yes. So since I wanted to do something that concerns with health, I looked at it like, okay, even nursing, it's fine. I can do it. Yes. So by the end of the day, I just chose to go for nursing because they do pick a number of nurses when it comes to deployment.
Okay.
Yes.
Well, that's true. But this is a field that's, dominated by females. In most places, you find more female nurses than male nurses. So, did anyone discourage you to say, don't do nursing, this job is for females?
Actually, a number of friends did. Yes, they did. Some were like, no, why can't you just go and do teaching? Can do any business course. Yes, but I personally wanted to do something that is more concerned with health. Yes, so that's the reason why I went to do nursing. But again, some people, yes, they might be negative, and there are other people that are positive about other people's choice. So I had my family; they were supportive. They were like, okay, since you've chosen, that's what you want to do. You can go for it. Yes,
Do your
and
friends still make fun of you now that you're working?
yes, more especially like if they find me on duty, instead of them saying brother Robert, they instead call me Sister
Sister.
Robert.
Yeah, how does that make you feel? Have you outgrown it?
Yes, at some point I used to feel bad. Yes, but with time I was like, it's just a name, and they are making it's more like fun for them. Yes.
Did you ever tell them that you don't like being called Sister Robert?
Yes, I did, but there are those friends that cannot just stop.
Okay, yeah. And the more you tell them not to do it, the more they want to do it.
Yes.
Yeah. Have you, now that you're working, do you still have those thoughts of maybe I should have chosen something else?
Actually, at this point, no. I once had that feeling the time I was a student. Yes. Looking at the way the studies were going, I was like, why did I choose this profession? But I got used to it. Yes, and then at this point, no, I don't have that feeling.
Okay, so when you were a student in your class, how many males were you as compared to females?
Uh, okay, we're a number of us as guys. I think we're about, if not 20 something, then we're about 30 something.
Out of how many?
Maybe out of 100.
Oh, okay.
Yes.
Those are good numbers. So, do you think more males are enrolling in nursing as compared to before?
Yes, yes. For that one, yes, more nurses have been enrolled. You mean at the institution level, maybe?
Yeah, no, at institution, even both.
Even both. Okay. Yes, with what I'm seeing right now in the wards, I'm seeing a number of male students, which is encouraging. Yes, compared to how it was last time. Because last time we would start maybe a 30 of us male students, but with time, some they will quit, not because they've got challenges, but they feel that's not their field. Yes.
Do you think some quit because people make fun of them that you are doing a female's job?
Ah, I think so. For some, we had other male students. For them, they had a number of things that they wanted to do. So you find that one wanted to do, like I said, I wanted to do radiography or COG, but the institution where they wanted to be enrolled from, maybe it was full. Yes. So they decided to join the nursing field. But with time, you find that they will change by the end of the day.
Because they want to do something else.
Yes.
Are there any things that you've heard about male nurses that are not true? I've heard a few of them. For example, some say male nurses are people who tried to do, or people who initially wanted to become doctors, but because of one reason or the other, they end up being male nurses.
For that one, I would say no for that one, because it all that thing of being called a doctor when you're a male nurse, it doesn't come from other healthy workers. For them personally, they know that okay, that guy is a male nurse. So it comes from the outside part.
That they call you male nurse.
No, they will
Or
call
they'll
us.
call you doctor.
Yes. So you find that even at the ward level, you're putting on white, like, oh, white, you being a nurse, that nurse uniform. You find that maybe a bedsider or maybe the patient, instead of them calling you brother or a brother, they'll instead call you doctor.
I've had a few experiences with that. So I was explaining to a patient something that they're supposed to do. And the patient told me, no, but doctor, maniuzati, mankwala ya siame. So I got confused. I'm like, but doctor, but doctor, but first, you know, like I'm the first doctor to attend to you. So which other doctor? No, the male doctor. So I got confused. I went to my male colleague. I'm like, did you give some information to the patient about what they should do? Then he said, no, it's not me. So I went back to her. Then I'm like, show me the doctor. Then she showed me the male nurse. So I was like, oh, I understand the confusion. So I was like, okay, what he told you were things that was a decision we made yesterday. So today, we've changed. This is what we're going to do. So I know it happens.
Yes, most of the times it happens. You find that maybe, I'm just with the doctor. We are the two of us. The doctor is doing the rounds, and I'm there helping. So instead of that patient calling the doctor as doctor, you find that the patient will end up calling the doctor by sister. If that
yes.
Yes, if she's female. And then the patient will end up calling me the doctor. So it happens.
Is there a situation where a patient has requested that I don't want a male nurse, I want a female nurse to attend to me?
Yes, it happens most of the times, especially when you are working from the female side. Yes, it happens. You'll find that you want to help the patient, but they'll request for a female nurse. Yes, it happens.
Is there a particular reason, or is it are those things where it involves the patient being naked, or is it just like anything?
I think it maybe if it involves the patient being naked, yes.
So they'd rather ask for
for a female nurse.
What about on the male side?
On the male side,
yes.
For that one, it's different.
How?
It's different. I feel like for the male patients, for them, they have it in mind that okay, a nurse is a female, and maybe the females are more knowledgeable than the male nurses. I don't know, or maybe it's because you've seen that male nurses. This is when they are getting interest in doing nursing.
Nursing,
Yes,
yeah.
so like female nurses, they know a lot of things compared to male
To male
nurses.
nurses.
Yes.
Okay. So usually the males are comfortable with the female nurses because they expect a nurse to be female.
Yeah, but at this point, they're okay with it.
Okay, so do you think patients are becoming more knowledgeable that a male can be a nurse and that a female can be a doctor? Because personally I've had experiences where a female, or let me not say female, a patient declined a procedure that I was supposed to do, saying that she wanted a male to do it. So I went on to ask her why she wanted a male, because it wasn't a procedure that involved her being naked. It was a relatively simple procedure. And what she told me was she believes that the male doctor will do it better than me. But of course, she has the right. When you come to the hospital, you have the right to choose that, okay,
Choose.
I want to be attended to by a female, or I want to be attended to by a male. I respected her decision, but I was hurt because I believe I'm qualified. I'm a qualified doctor, and even the male doctors are also qualified doctors. So I was hurt because I think it's something that I would have done. But anyway, I respect her decision. Yeah. So do you think that they're becoming more knowledgeable? Are more patients knowing that you are a nurse and not a doctor?
Yes, yes, they are knowing. As at this point, yes, they are, because you find that even they are now requesting for us male nurses. If they want anything, they would rather say no. Let me have a male nurse than a female nurse to do this thing. Yes.
Okay. So now they know that females can be nurses and the males can also be nurses.
Yes.
Which is a good thing, because if you're not comfortable with a male, you can ask for a female. Which is okay. I once had this patient come in. So he was failing to talk. I was asking him, like, what has brought you to the hospital today? He was failing to talk. He was just like, I looked at his referral letter and I understood, and was like, that's why you're failing to talk. So the referral letter showed that he was having problems, like sexual problems.
Okay.
So he wasn't comfortable talking to me. So I asked him, would you want a male doctor? Then I saw him become comfortable. He's like, yes, please bring me a male doctor. And that's how I requested for one of my male colleagues to come and attend to him. And he was more comfortable. He talked to him, gave him all the information. And I think that's something that sometimes patients, they don't know, that you can actually, if you're not comfortable, you can
Ask
request.
for someone else.
Yeah, you can ask for someone else. It's within your right.
Okay, yes, yes, it can be within their rights, but again, they should know that the hospital or maybe the clinic, it will become overwhelmed sometimes.
That's true.
Yes, so they shouldn't be like refusing or maybe choosing that let me be attended to either female or male.
Yeah.
Because at some point they will find that there will be no. Let me give an example. Maybe for a male, he's not going to find a male doctor there. Yes. For example, in the clinics, you find that there's only one clinician working there, and that's a male, or maybe that's a female. And if you say I cannot be attended to her, or maybe him, meaning you won't be helped.
Yeah, that's the other challenge, because you may ask for someone like the same colleague I requested for. So that colleague was actually seeing other patients. So that patient had to wait for him to finish seeing the other patients and be attended to. So that also happens. And in this day and age, I mean, there are situations where you find it's just one sex that's working. Maybe you find all male nurses, all male doctors. Yeah, there are situations where that happens. Yeah. But for some, we try to understand, especially if it's your tradition, where a male is not supposed to see you or a female is not supposed to see you. So there are those special cases where it's their tradition, so we can't really.
Go in their field as well.
Yeah, like you can't tell them that no, they won't be seen, because you have somehow you have to meet at some point and just, yeah, and help them. We always find a way to help
Yes.
patients, and I like that.
Mm.
Anyway, I think I talk too much.
No.
Yeah. Is there any situation, or have you heard of anything where females are more favored in nursing?
uh, no, not really.
Mm-hmm.
No, at some point I felt that way. Like females are more favored than us males.
Mm-hmm.
But when I came to see what really happens, so I don't know, it's fine. It's just okay.
So it's equal.
Yes,
Everyone is
it's
treated
equal.
equally.
Yes, like I can give an example in terms of going back at school.
Mm-hmm.
Yes, I thought maybe it was something like you just have to tell the in charge that you want to do this and this, you want to go back at school.
Mm-hmm.
You would see like a number of female nurses there maybe on the list compared to
males.
yes. So I came to realize just now when they said no, you need to apply.
Okay.
Yes, you need to apply and then they need to approve. So meaning the list that I saw was for a long time ago that was made. Yes.
Meaning that they applied.
Yes, and I'm sure by that time maybe they had less male nurses. But as at now, things are just okay. If I feel like going at school, I need to
apply.
book. In short, you need to book. Yes, you need to book. But if you feel like just going for, like maybe you want to do distance, you can start. But if you want to get that leave, meaning you have to follow the procedure, the process. Yes.
Well, that's good to know. Even in my field, I don't think I can say males are favored more than females. No, I think we all have like equal opportunities to do things, even advancing your studies, like you've put it. We all have equal opportunities.
And again, I thought maybe for males, for you to become an in charge, or maybe for you to start you being the head of that ward, you have to reach certain age or maybe a certain level of education. But I was proven wrong, because one of my friends, actually, maybe I think we are just of the same age mates. He took charge of a certain ward, and I was like, okay, you're my friend, you're young, and looking at the people that you're leading,
Yeah.
he proved me wrong. Even now, he's still there. So like that, I was like, okay, there's nothing like females are favored or men are favored. No, it's equal.
Yeah, I'm very happy to hear that, because what people see outside is very different from what happens like in the hospitals.
Yes.
Yeah. And some people really have a wrong notion about male nurses. Did you ever in your life, or as you finished your education, did you ever think of becoming a doctor? or did you just think of doing clinical medicine? Because one of the things that people out there think is that the male nurses wanted to be doctors, but fiashu pirefe, then they become nurses.
If you want to become something, there's always the starting part. Yes, and you cannot just start and end up being there. No. So for me, yes, I wanted to do overseas medicine. Yes, but when you go to an institution, of course, they ask you to provide the overseas, the results and what, and then they are going to advise you. Yes, so as they advise you with time, it's up to me to assist to upgrade. Yes. So for now, yes, we are still pushing. We are pushing, like as of now. What I want to do is I want to upgrade to theater nursing.
What do you eventually want to do, like ultimately?
Ultimately, I think medicine.
Okay.
Yes.
So, but there are some male nurses out there who just wanted to become male nurses, nothing else.
I think so. Yes. I think so. But with time again, they realize that okay, let me upgrade to something else.
Now, with this upgrading, now I don't know if this is a right question to ask, but most of the nurses that I've interacted with, be it male or female, one of the things that really encourage them to upgrade is the pay.
Okay, yes. Even the
Even the pay
even the pay,
contributes.
yes. Even the pay. But you know, for what's this in health, it's more like like I said it before, it's a coding. Yes. If you are called to be a doctor, you're not going to, you won't mind of what is the pay. Yes, because trust me, there are other people that are being paid more money than doctors.
And
Yes,
the nurses.
and nurses, yes. But they have decided to stay within let me say their faculty. If it's nursing, they've decided to stay in nursing. If it's being a doctor, they've decided just be a doctor. Yes.
Yeah. And one thing that people don't know, that actually nurses are, they're bosses of the hospital.
Yes, that I know.
You are the bosses of the hospital. Like, that's one thing people don't understand. I had someone who wanted to visit a patient on the ward. So they asked the nurse, and the nurse said, look, this is a contagious ward.
Yes.
So we can't just have people coming in and out.
Yes.
So you come at the allocated visiting hour.
Yes.
So the bedsider decided to come and ask me to say, can I please give this to my patient? Thinking that I have more say. And I was like, no, have you spoken to my boss there? And she was like, no, your boss has said no. The nurse said no. I'm like, if she says no, then it's no. She is the ward manager. This is her ward. Even if she says that, Dr. Yvette, you can't go into the ward today, I won't go into the ward. So that's one thing that people don't know. People think we are the bosses, but I believe you guys are the bosses.
Yes, I think for that one, I would say yes, we may be the bosses of the world. Reason being, I'm sure this is true. Nurses get to spend more time with patients compared with doctors.
Yes.
Because you find that during the night we are with the patients. We can only call for a doctor during the night if if you've got what's this, an emergency, that's when we'll get to call the doctor. The doctor would see the patient. After some time, the doctor will be called somewhere else. We remain with that patient. So we know them better. Yes, so even when the bedside does say, but be shash, and sometimes it's for their own benefits. Yes, like even for the benefits of the patient. For example, you know how burns are. We cannot keep on letting other people from outside
yeah.
coming in because their skin is open. Yes, so those are our patients. When they are within the hospital, they are ours. Yes.
I was telling one of the bedsiders, she was basically she was very rude to one of the nurses, and I told her, like, look, you can't be that rude. Like, you have to respect the nurses, and they'll respect you back. I'm here now, but I'm going to leave you. And who are you going to remain with? You're going to remain with the nurses. And it's not nice living living with people and you're not in good terms. So I think people should respect nurses, in as much as nurses should also respect people.
The
And
bedsiders, yes.
and the most common thing I hear is that nurses are rude. Very rude. What's your comment on that?
No, for that one, I would say.
Robert, why are you rude?
Huh?
Why are you rude?
Okay, for me,
Uh,
I don't know, but for me, I see myself for like I'm not rude. Yes, unless if maybe someone pushes me. You know, there's always that thing of you can tolerate someone to a certain limit.
extent, yes.
Yes. So I believe even my fellow nurses, they are not rude. It's the way, it's the approach. Yes. If someone approaches me in a bad way, I try to talk to them, but they are not listening. Automatically, we are going to lose it as well. But losing it, I don't mean like you start exchanging words with. No. Sometimes to avoid the problem, it's even better you just walk away, or maybe get someone else to talk to that bedside, or maybe a patient if they're not coming into assess mutual understanding. Yes.
Sometimes as well, when bedsiders come, when they're in the hospital, I feel like they are, what can I say, vulnerable. They're very emotional also, and sometimes they expect us to understand. Sometimes they're also, bedsiders can be rude, and they expect us to just take it because they have a patient. But they also forget that we're also just human, and we need to work together to live together for the betterment of that patient.
Yes.
Yeah, so sometimes bedsiders can be rude, not only nurses, but also there's some nurses who are rude, Robert. To be honest, not just to patients, but even to us. I think at some point you just have to understand, like, okay, everyone is different. There are some nurses who are rude. There's some doctors who are rude, and that's just them. And there are also some nurses who are very kind, very gentle, and there are also doctors who are kind and gentle. Right.
Okay. Yes. For that one, I would say, when you say there are doctors that are rude and nurses that are rude, let's say if a nurse is being rude to a doctor, meaning it's obvious maybe there is someone who didn't approach your friend in a correct way. Yes.
I think so.
Yeah. There are certain doctors that feel like they are more intelligent. They know a lot of things. Yes, they know a lot of things than us nurses, and they try as much as possible to show it. Yes.
So then you try to humble them.
Yes, like you need to show them okay, what you want to do right now. I can do it as well. But it's just that we try to be professional. If you know that, okay, before I do this, let me call the doctor to come so that he or she may intervene in the worst in the situation. And then you find that maybe if the doctor comes, the doctor will maybe assume like you don't know what to do. Why did you call the doctor? Or maybe why did you call me?
Like you can't do this.
Yes, meaning you don't know.
I see.
So
Well,
like that I would react as well. Like I was just trying to be professional so that we can work as a team. Can give an example. There are times whereby you're having doctors round with maybe let's say consultants, and then you are there as a doctor with a patient, forgetting that as nurses we spend more time with these patients. We know what happens. Aye. For example, a patient was having fits during the night. You are not there. Aye. When you come in the morning, at least you need to find out, okay, how was the patient? Yes, you won't ask anything, and then you just go straight to the patient. And then when you're having when you're having the doctors round, the consultant might ask you, when last did the patient fit? You are not there. You will say the patient the last time he had fits was last week. And then myself I won't say it because at least maybe I might try to cover up for him, or maybe aside I'll tell him that no, actually the patient was fitting during the night. But these bedsiders, you've got bedsiders that are knowledgeable. They know what happens. They will just come out open in front of the consultant. They'll be like, actually, no, doctor, it wasn't last week. Last night the patient was fitting. Yes. So like that, it doesn't look good, or maybe it doesn't look professional. It shows that we are not
working
Yes, we are
together.
not working together as doctors and
And
nurses.
nurses.
Yes. So
So in that scenario, well, I'm assuming it happened to you. Did it happen to you?
not really me, but it's something that happened.
Oh, okay. I was going to ask, was the doctor upset with you? I'm assuming the junior doctor, were they upset that, oh, why didn't you tell me earlier that the patient was fitting yesterday? Because now my consultant thinks I'm not doing my
No,
job.
okay, look, it's more like you've come to our ward. When I follow you, it means that, okay, I'm expecting that, okay, you're going to ask me what happened during the night. There are certain doctors, let me say if you're dealing with Benz, they will actually ask you, how were the vitals? Did the temperature spike or what? Like that, meaning he wants to know. And then there are others, they will just get the files and go and see the patient there without the nurses or a nurse accompanying them. Yes.
But sometimes, well, I think there are a few times when I've just gotten the files, because I also understand that manpower on the ward sometimes is quite bad. So maybe you'll be doing something and I don't want to disturb you.
No, for that one, I would say most of the times we do usually allocate ourselves. Yes. So if I'm allocated in a certain bay, yes, we call them bay, but maybe I might say cubicles, yes, for the viewers to understand.
Yeah.
So for you as a doctor, if you're working where I'm working from, automatically, yes, I'm supposed to attend to you. Yes, so that even as you write your orders, I should be aware that, okay, the doctor's done this, and the doctor's done what has instructed me to do this. So, take, for instance, you write something in a file, you put IV fluids, and then without informing the nurse, it's going to be challenging for or rather it's going to look as though maybe I wasn't serious the time I was working there in the bed when it's time to give handover. I would just say, the doctor came, but the doctor didn't mention anything. That's if I don't go through the file. But if I go through the file, I'll be like, okay, there are IV fluids I'm supposed to commence. But again, it's going to be like, I'll, instead of me starting the IV fluids right there and then when you write the notes, but if I notice that's at 12, meaning I would delay. Yes.
So that's why we're supposed to work together. Anyway, I hope that's one of the things that will change in the near future, that we doctors and nurses can work better together for the patients.
Yes.
Is there any experience that you've had that has, where you felt like, okay, this is why I chose medicine, like, and this is why I chose, to become a nurse? Any experiences that felt so fulfilling? For me, it's once there was a patient I received, a young boy, who was having a severe headache for a very, very long time, and a CT scan was done, and it was found that there was actually a tumor. Okay. And then I got the neurosurgeons involved. For me, that was kind of fulfilling. Like, I felt like I made a difference.
Actually, yes, it does happen. Like, let's say, if there's a certain procedure that needs to be done, you'll find that maybe some nurses, they tried, and when I maybe I report for duty, and then I find that handover, like, okay, there's this and this that was supposed to be done, but it wasn't supposed to be done. Then they say, maybe you should consult the doctors to come and help. And I'll be like, okay, but before we consult the doctors, let me attempt. And then if I do it, I'll be like, I think this was my field. I was meant to do this.
Yeah, that's really nice. There's something I heard. Don't take offense. And no one should take offense. So someone once passed a comment saying that male nurses, there's like a something about them.
Something.
Like something.
What's that? Something.
Like something, like they have gay traits.
No, really.
You've never heard that before?
No, that's new to me.
Yeah, there's someone who passed that comment.
Okay,
a health professional even.
No.
Yeah. And I was like, I haven't
maybe
noticed.
that person was from a different field, not
a nurse.
No,
it was a different field. Yes.
Okay, maybe for him he took it that way because we male nurses, we are found most of the times with ladies. Yes, not just ladies, let me say female nurses. Yes. So that interaction that we have, so you'll find that most of the times we do, how can I put it? You find that we do interact with more females. So even as you are interacting with, in short, let me just say, kulaba di mokusambira fye omulomo. Yes, there's that thing like where.
So nurses gossip a lot.
Huh? No, but yes, they, as in when they are talking,
like chatting, yeah.
Yes, when you are chatting, even you as a guy, sometimes you would sit, let me be a man, let me just sit this side, but by the end of the day you find that you've joined them in their conversation. As a guy, they post it up, not post it up. So maybe for that guy who said that they
Maybe, yeah. Maybe that's where he got it from. But also, some of those things actually keep us sane. The hospital can be, hey, it can be stressful. So when you have a good laugh, for me, I usually get along with the nurses that I work with most of the time. So we interact a lot. So you find I'm by the nurses' bay and we'll be chatting and we'll have a little laugh. Actually, there's someone who misunderstood us. Someone passed a joke at the nurses' bay, and there's a patient who got offended that we were laughing in the ward.
no.
Because it's also work for us, and I don't know if people expect us to be gloomy all the time, but once in a while, you laugh at each other, like something you did that didn't make sense, and you're like, but why did you do that? You laugh. Then this patient got really offended, and she was like, are you people laughing at me? Yeah. Like, are you people laughing at me? So we said, no. It's just a conversation that we were having on the nurses' bay. So now, in the ward, everyone now became,
Quiet.
we became tense because now we didn't want to offend anyone like that. It was quite sad. Imagine a patient coming to tell you that. Like, were you laughing at me? We felt so bad and we're like, no. We explained, like, no, we're not laughing at you. Then, she calmed down. So then we started being cautious of, of what we were doing. Like, okay, guys, no more jokes. Let's just work. Maybe if we're telling a joke, maybe we tell it maybe where a patient cannot hear us or something. Yeah.
But again, you cannot just be serious forever when you're working. At least there should be that moment, like you pass a joke, you laugh. It's healthy even for us.
It is. Because working in the hospital is very, very challenging. It kind of plays with your emotions. So imagine, Robert, you're working in your bay, eh?
Yes.
And the patient on bed 1 receives news that they have cancer.
Mm-hmm.
And because you're there, you have to sit down with the patient, interact with them, make them feel more comfortable, reassure them that things are going to be okay and things like that, because it's part of the job.
Yes.
And then you move along. Bed 3 has been discharged because they are fine, and bed 3 is celebrating. Now, you can't take those emotions that you were feeling about the cancer patient, because this is a whole totally different situation. The patient is celebrating. So now, Robert, you have to be happy for that patient.
The patient has been discharged.
Yes. So you see, it really plays on your emotions. So you're sad here, then you have to be here. You have to be happy here because this patient has made progress. And then maybe another patient will be sad. You have to be sad. And then the other patient will be happy and excited. So you have to be happy and excited. It really plays on your emotions.
Yeah.
So sometimes we do crack a little joke, but I've never heard anyone cracking a joke about a patient and we just laugh.
No. That doesn't happen. Like, you cannot. Maybe there are other patients, like more especially surgery. Let's say someone with a fracture. There are other patients, they love joking with nurses.
Yes.
I can give an example, like on my part. Let's say if that patient is from, let's say it's from Northern Province, that person is Bemba, and I'm from the Eastern. You'll find that they'll be giving those, what do you call them, the Chimbuya jokes.
Yeah.
Yes, and then we'll be laughing like that. Yes, it happens like that.
So maybe someone even got offended that you're laughing like that. Yeah, because anyway, sometimes I think depending on the condition, some patients are a bit insecure. So anyone who's laughing or whispering around them, they always feel like, okay, maybe it's about me because I have this condition, which really is not the case most of the time. Yeah.
So meaning they've got is it low self-esteem.
Yeah, low self-esteem brought on because of the condition they have.
Mm,
Yeah. So is there anything that you would like to see improve in the nursing community?
the nursing community.
Mm.
I would just say they should for the guys, I would say they should keep on enrolling as male nurses.
Mm.
It's it's not like the way it used to be. Things are okay now. We are there. Automatically, when you're deployed, they'll find us. We will welcome them. Otherwise, it's a very good thing to do. Yes, being a male nurse. So I feel even for the overseas, in terms of the deployment thing, they should at least maybe increase in the number. But again, they cannot increase the number of male nurses if
If
we've
people are
got,
not
yes.
enrolling.
Yes.
Well, I also hope that the community can learn that nursing is not only meant for females. Anyone can be a nurse, um, and anyone can study medicine. It's also not just for the males. So if someone wants to become a male nurse, do not discourage them. Do not make fun of them. Yeah, because I'm sure some people have dropped out of the program because of that. And now maybe they're not doing anything and they're just, regretting.
Yeah, like me at some point I actually thought maybe let me just change.
Yeah. So I think the community also contributes, like encourage people to become male nurses. And I don't know what people imagine that you do, but you can, as a nurse, you further your studies, you know?
Yes.
Yeah.
Actually, you can even because there's saying that's going on that actually male nurses are very good in terms of deliveries.
Oh yeah, some people prefer male, either male doctors or male midwives. They're called male midwives, ka?
Yes. Or maybe they
Yes,
should put me husbands.
maybe. Yeah, they actually prefer. I don't know. I don't know why. Maybe one day I'll find out because I've heard it from a lot of females saying that the males are usually good. But only God knows why. Or the females. Maybe the females can tell us why they prefer being delivered by a male. But also sometimes, we ladies, where there are a lot of ladies, there are always issues.
Yes.
I don't know why we don't like each other, but I hope that can also change. Anyway,
You
Robert.
know, when you're working, where there's let me say, let's say in our field, if if we nurses, let me just say in general, the nurses, if we are not coordinating, meaning we are not helping out.
That's true.
Yes. So for our sector to be, or maybe for our ward to be better, we need to coordinate because we are not. For me, I'm not doing it for myself. No. When I wake up in the morning, I would say I'm going for work, meaning I'm going to look at a patient. Yes, and by the end of the day, we want that patient to assist for what is the condition to improve and
And they
patient
can go
gets
home.
better.
Yeah.
But if we are not coordinating, even let me not just say to the nurses, but the entire team, doctors, nurses, if we are not cooperative like that, meaning
We're not helping
we are
the
not
patient.
helping the patients.
Yeah. That's very true what you've said. And I really hope that we can work together as a team.
Yeah.
But Robert, thank you so much for coming. It was really insightful.
Thank you very much for hosting me once again.
Yes, and we'll definitely have another conversation soon.
Sure.
If you allow me to have another conversation with you.
Looking forward to that.
Okay, guys. Thank you so much for joining us today. Don't forget to subscribe and follow me as well. This was Health with Dr. Yvette Maseka. Bye.